Hi everyone, my name is Laura Lee, and I'm currently a pharmacist here at the Valley Hospital. And today I'll be giving a presentation on secondary stroke prevention. So we'll be discussing what that means and what secondary stroke prevention entails. So by the end of this presentation, you should all be able to explain what a stroke is and be able to explain the different risk factors of stroke. You should be able to recognize different medications that are used for the secondary prevention of stroke and be able to discuss the side effects of these medications. Starting off, I'll discuss what exactly a stroke is. So a stroke is going to occur when blood flow to an area of the brain is interrupted. As a result, the brain is not going to receive adequate oxygen, and that's going to cause our brain cells and our tissues to start to die, and that will ultimately lead to a loss of brain function. Now, there are different types of strokes. First, we have an ischemic stroke. So that's what we discussed in the previous slide, and that's when you have an interruption of blood flow to the brain, which is going to lead to a loss of brain function. Then we have a transient ischemic attack. So that's considered a temporary interruption of blood flow to the brain, and this will not result in permanent damage, but it may serve as a warning sign for a future stroke. And lastly, we have hemorrhagic strokes, and that occurs when a blood vessel in the brain ruptures, and that basically leads to bleeding in the brain. Now, there are certain factors that can increase one's risk of developing a stroke, and that would include hypertension or high blood pressure, dyslipidemia or high cholesterol, diabetes, smoking, or physical inactivity. Now, these are all considered modifiable risk factors, meaning they can be changed. And then on the other hand, we also have our non-modifiable risk factors, which can be changed, and this would include older age, race and ethnicity, and having a family history of stroke. So now we'll go into discussing what primary prevention and secondary prevention of stroke means. Primary prevention would be when we prevent the stroke before it even occurs, and secondary prevention is when we treat patients who have already had a stroke in order to prevent a second stroke. Now, secondary prevention of stroke is going to include managing your modifiable risk factors with the use of antithrombotics, by controlling or reducing blood pressure, by lowering cholesterol, and by making modifications to one's lifestyle. And it's been shown that treating these major risk factors can actually reduce the risk of a repeat stroke by 80%, which is quite significant. Oops, sorry about that. So now I'm just going to start going into the specifics of secondary prevention, and I'm going to start off by discussing antithrombotics firstly. So antithrombotics is a term that includes both antiplatelets and anticoagulants. Our antiplatelets are going to include aspirin, clopidogrel, ticagrelor, and prasugrel, and I've also included their brand names in the parentheses just for your reference. And I'm sure some of these names on the slide may be familiar to you guys. And for our anticoagulants, we have apixaban, rivaroxaban, dabigatran, edoxaban, warfarin, and enoxaparin. And I'd also just like to point out that I'm not listing all of the different antiplatelets and anticoagulants on the slide. So it's possible that you may be taking one that I haven't listed, which is perfectly fine as well. I've just listed some of the more commonly used antithrombotics. So now I'll go into discussing antiplatelets in a bit more detail. The purpose of our antiplatelets is to prevent our platelets from clumping and forming a blood clot, and this will ensure normal blood flow to our brain. There are some side effects to this class of medication, which includes bleeding, stomach upset, and allergic reactions. Now, antiplatelets can interact with some other drugs. This can include nonsteroidal anti-inflammatory drugs, also known as NSAIDs, which includes ibuprofen or naproxen. The combination of an NSAID plus an antiplatelet can increase your risk of bleeding. And antiplatelets can similarly interact with selective serotonin reuptake inhibitors to increase your risk of bleeding. There are also vitamin and supplement interactions to be aware of. So antiplatelets can interact with garlic, ginger, ginkgo, ginseng, vitamin E, and omega-3 fatty acids to also increase your risk of bleeding. Now here I've just listed some of the common doses of antiplatelets. So we have aspirin, 81 milligrams by mouth daily. There's clopidogrel, 75 milligrams by mouth daily, and also ticagrelor, 90 milligrams by mouth twice daily may be frequently used. There's also something known as dual antiplatelet therapy, and this is when select patients are on 2 antiplatelets for a period of time. And some common dual antiplatelet therapy regimens include aspirin plus clopidogrel for up to 90 days, or aspirin plus ticagrelor for up to 30 days. So now we have our anticoagulants, and these agents work by slowing down clotting, which is going to prevent blood clots from forming and growing. And anticoagulants are commonly used in patients who have chronic non-valvular atrial fibrillation, and this is because in AFib, blood can pool inside the heart, and that can cause a clot to form, and this clot can then travel up to the brain and cause a stroke. So you want to use anticoagulants in order to prevent that. And on this slide, I've included some of the common agents and some of the common dosing regimens. And to note, the side effects and drug interactions are similar as our antiplatelets. So now I'll end off our discussion on antithrombotics with some key points. So something important to remember with our antiplatelets and anticoagulants is that these agents increase your risk of bleeding. So this can result in nosebleeds, bruising, blood in the urine or the stool, heavy menstruation for women, or bleeding from the gums. If you notice you're bleeding severely or bleeding frequently, then you should definitely reach out to your doctor. You should also let your doctor know if you have any upcoming surgical procedures or dental appointments, and this is because your doctor may want to hold your antithrombotic for several days before the surgical procedure or dental appointment. Of course, this is depends on a case-by-case scenario, so definitely speak to your doctor and have that discussion with them if that pertains to you. And also reach out to your doctor before starting any vitamins or supplements in order to ensure there's no drug interactions with your antiplatelets or anticoagulants. And lastly, even if you show no visible signs of bleeding after a fall, you should reach out to your doctor. And that's because you do run a risk of having internal bleeding despite not showing any external signs of bleeding. So it's better to be safe rather than sorry. So definitely reach out to your doctor after a fall. So next we'll go into discussing antihypertensives. This is just a fancier word for blood pressure medication. And there's many different classes of blood pressure medications. On this slide, I'm only covering 3 different classes. So first we have our thiazide diuretics. This includes hydrochlorothiazide or chlorthalidone. We also have our angiotensin converting enzyme inhibitors or ACE inhibitors. This includes lisinopril or enalapril. And then lastly, we have angiotensin 2 receptor blockers, also known as ARBs, and this would include losartan and valsartan. Again, I've included the brand names in parentheses just for your reference. And again, just want to point out these are not all of the different blood pressure medications that exist. So again, it's possible you may be on a blood pressure medication that I haven't listed on this slide, which is perfectly fine. So the purpose of these blood pressure medications is to, of course, treat high blood pressure, which is a risk factor for stroke. Increased blood pressures can actually damage the arteries throughout our bodies, including the arteries in our brain. And that's going to potentially increase the risk of a stroke. So in order to prevent that, it's important to control your blood pressure with these agents. And the goal blood pressure we're aiming for is less than 130/80. And there are some side effects associated with these agents. So with our thiazide diuretics, we may see low potassium levels, low sodium levels, high calcium levels, or high uric acid levels, which may increase your risk of gout. And also to note with diuretics, they're going to increase urine output. So as a result, it's better to take these agents earlier in the day as opposed to later in the day, because if you take them later in the day, you may notice yourself getting up frequently while sleeping in order to use the bathroom. So in order to just make things more convenient for you, it may be better to take your diuretics earlier in the morning. As for our ACE inhibitors, we may experience swelling, kidney injury, high potassium levels, or a non-productive cough. And with our ARBs, we may see kidney injury, high potassium levels, and a non-productive cough. Now, it's also important to monitor your blood pressure at home regularly just to make sure your medications are working and to make sure your blood pressure is well controlled. So, you want to make sure you choose an automated device that uses an upper arm cuff because these have been shown to be accurate or more accurate than other devices. And you want to check your blood pressure at least twice daily. So, once in the morning before eating or taking any medication, and once in the evening. And you want to be consistent as possible with the times you check your blood pressure. And each time you check your blood pressure, you want to take at least 2 readings that are 1 minute apart each time. Now, there is a correct way and an incorrect way to measure your blood pressure, so I'll just go over what the correct technique entails. You want to make sure you avoid any food, drinking, or exercise within 30 minutes of measuring your blood pressure. You want to make sure you empty your bladder before measuring your blood pressure. You want to sit with your back straight and supported. Your feet should be flat on the floor and your legs should not be crossed. You want your arm to be supported on a flat surface with the upper arm at your heart level. And you want to sit quietly for at least 5 minutes before measuring your blood pressure. And you want to make sure to not put the blood pressure cuff over your clothes. And then the image on the right, we just see a man who is measuring his blood pressure the correct way. So he is practicing the proper technique. So now I'll move on to discussing a class of drugs known as statins, and it's called statins because their names all end with statin. So we have atorvastatin, rosuvastatin, simvastatin, pravastatin, fluvastatin, and lovastatin. And I want to just emphasize atorvastatin because this is the specific statin that's recommended for secondary prevention of stroke. Now, the purpose of this class of medication is to lower your LDL cholesterol, and it's also been shown to decrease the risk of stroke. So as I said before, the recommended statin is atorvastatin at a dose of 80 milligrams by mouth daily. The goal LDL cholesterol level we're aiming for is less than 70. And of course, there are side effects associated with this medication, which may include liver damage, muscle pain, or increased blood sugar levels. Now we'll move on to diabetes management for those who have had a stroke. So patients with type 2 diabetes and established cardiovascular disease, such as a stroke, are recommended to be on a sodium glucose cotransporter 2 inhibitor, also known as an SGLT2 inhibitor, and this includes empagliflozin, dapagliflozin, or canagliflozin, or they're recommended to be on a glucagon-like peptide-1 receptor agonist, also called GLP-1RA, and this would include semaglutide or dulaglutide. Now, for these patients, the goal hemoglobin A1C level will be less than 7 for most of them, and just to remind you all, hemoglobin A1C or HbA1c is a term that refers to the average blood sugar level, that refers to your average blood sugar level over the past 3 months. And it basically just provides us with an idea of how well your diabetes medication is working and if it's been effective or not. So for most non-pregnant adults, we're going to aim for an HbA1c level of less than 7%. And for older adults who have multiple chronic conditions, we can be a bit more lenient with our goal. So their goal would be less than 8%. And lastly, we want to try to make changes to our lifestyle, and this would include quitting smoking, also partaking in physical exercise. So this would include a moderate intensity exercise for at least 10 minutes for 4 times a week, or a vigorous intensity exercise for at least 20 minutes for 2 times a week. It's also recommended to practice a Mediterranean type diet and to reduce your sodium intake by at least 1 gram per day or maintain a daily sodium intake of less than 2.5 grams per day. And lastly, it's recommended to stop or reduce alcohol consumption. Now on this slide here, it just discusses what a Mediterranean type diet entails. It's going to be a lot of vegetables, fruits, nuts, legumes, poultry, fish, low-fat dairy, and whole grains. And you want to try to avoid added sugars, sugary beverages, or processed foods. And on this slide here, I just want to end off by providing you with some resources which contain some useful information. So we have the American Stroke Association, the Center for Disease Control and Prevention, the American Stroke Foundation, and lastly, the Stroke Support Association. So hopefully you guys will be able to find these resources helpful. And in conclusion, we spent some time today discussing secondary prevention of stroke, what it is and what it entails. So secondary prevention of stroke is going to require the management of various risk factors, particularly our modifiable risk factors. And some important medications for secondary prevention include the use of antithrombotics, our blood pressure medications, our statins, and also we have our SGLT2 inhibitors and our GLP-1RAs. And lastly, lifestyle management plays a big role in reducing one's risk of a future stroke. And as we saw in one of the previous slides, it's been shown to actually reduce the risk of a recurrent stroke by 80%. So definitely a significant drop. So here I just have some questions to quickly go over with you all. So over here, we're just asking which of the following statements is true. And statement B states secondary prevention is treating patients who have already had a stroke to prevent it from happening again. So that would be our true statement. If we look at A, that states secondary prevention is preventing a stroke before it occurs, which is false because that would be primary prevention. And choice C states secondary prevention only consists of lifestyle changes, which is not true because it does not consist of only that. And choice D states secondary prevention only involves the management of high blood pressure, which is false because it does not involve only that. Now this question here is asking what is the purpose of an antiplatelet in stroke prevention? And the correct answer is A, antiplatelets prevent blood clot formation to ensure normal blood flow to the brain. Choice B states antiplatelets work by lowering blood pressure, which will allow normal blood flow to the brain, and that's false because that would be talking about our blood pressure medications, our antihypertensives. Choice C states antiplatelets lower cholesterol levels, which is a risk factor for stroke. That's false because that would be referring to our statins. And choice D states antiplatelets lower blood pressure, which is a risk factor of stroke, which is false because, again, that's our blood pressure medications we're talking about. Now this question here is asking what is the goal HbA1c, and the correct answer is B, less than 7% for most non-pregnant adults. And then for older adults who have multiple chronic conditions, the goal would be less than 8%. And this question is asking which of the following are appropriate lifestyle management strategies to reduce one's risk of stroke, and the correct answer is all of the above. So now there are some questions that were asked during the live presentation, so I'll just go over them real quick. So the first one was asking, do any of these drug classes have side effects that affect sexual function? So the thiazide diuretics may affect sexual function. So we talked about hydrochlorothiazide and chlorthalidone in this presentation. The ACE inhibitors may also affect sexual function, and also certain statins have been shown to affect sexual function. Next, we have why would you not jump right into using an anticoagulant, even if it's unknown whether or not the patient has atrial fibrillation? And this is because our anticoagulants have serious side effects, such as the increased risk of bleeding. So really, we don't want to put patients at this increased risk of bleeding if it's not necessary, because it's possible that it may lead to like an intracranial hemorrhage, which can be quite severe. So because of that severe and serious risk of bleeding, that's usually why we're not going to jump right into an anticoagulant unless a patient is actually diagnosed with having atrial fibrillation. So it's all a risk versus benefit. We're also asked, are these medications covered by Medicare? If they are not, are there other ways to make them more affordable? So certain medications will have manufacturer coupons. So for example, we discussed antithrombotics in today's presentation, and Eliquis is also known as apixaban. So that's an anticoagulant that's commonly used. And if you go on the company's website, you'll see that they do offer a coupon or this $10 copay card. So this could be an option for some of our more expensive medications. This question here is asking, why do some medications recommend eating before you take them? And this is because eating and taking these medications with food may improve the absorption of the medication and therefore increase its effectiveness. Also, eating can help to reduce side effects such as stomach irritation. We also got asked what kind of medication is metoprolol. So metoprolol belongs to a class of medications known as beta blockers, and it can be used to reduce the heart rate in patients who have atrial fibrillation, but can also be used to lower high blood pressure. How risky is it to skip a dose or two of your medication? Do some have higher risk than others? What happens if I stop taking my medication? So typically, you should not skip your medications unless directed to do so by a doctor. So for example, we have our anticoagulants, which are used in patients who have atrial fibrillation to prevent strokes. But if you miss your anticoagulant doses, your risk of a stroke will increase. And the next slide is going to provide recommendations on how to remember to take your medications. So you could use pill boxes, you can set alarms on your phone or reminders, you could leave yourself little post-it notes in visible locations that will serve as a reminder. You can record each dose of medication you take in a medication journal or a calendar. Or whenever you take your medication, you can flip the pill bottle over, and that can kind of serve as your reminder as to whether or not you took that medication that day. So those were all the questions that were discussed during the live presentation, which I'm just going over again in this recording. So I just want to thank you all for listening to this presentation, and to those of you who came to the live presentation. If you have any further questions, my email is up here on the slide for your reference. And thanks so much, and here are my references.